Welcome to In the Cool of the Day, and today's segment, From Behind the Podium, Conversations about Law and Faith. I'm your new host, Reverend Dr. Sharon Anderson, and I am so excited about the program today. From Behind the Podium is a new segment which will introduce conversations about everyday legal issues and issues of faith. And our goal throughout this program is to inspire and empower you to overcome challenging issues in your life. We have a dynamic conversation for you today, and a conversation which is very relevant and concerning to many throughout our nation. Issues of mental health have been prevailing in many areas in our country. With the Fort Hood shooting, with the shooting at the Navy Yard in Washington, D.C., with the recent abduction of a young girl from a shelter in Washington, D.C., we have many issues that the church needs to discuss related to mental health issues. And I have a great group of guests that are going to help us discuss this today. First, we have Prophetess Deborah Webb, who is a pastor. She's a CEO and a great encourager of pastors in our nation, as well as in the District of Columbia area. We have Mr. Dwayne Jones, who's the CEO of Preventive Measures with us, which is a behavioral health organization. And we have Dr. Sharon Moloch, who is an associate professor at GW University and also a co-pastor in Accokeek, Maryland. And so we're going to get right into our discussion today, and I really do believe and pray you will find it helpful to you. So Prophetess Webb, tell us about DKWeb Ministries. Tell us about your decision to be a chaplain at St. Elizabeth Hospital. And then also tell us from your standpoint, are there emerging issues with respect to mental health in the African American church today?
Okay, Pastor, do I have to answer in that order, or can I go? I like to save myself for last. I don't like to talk about myself too much, but I know it's necessary. But in answer to the last question, I really do believe that there is a trend in the African American church, particularly with even suicide with pastors. And historically, with African Americans, due to the mistrust of the healthcare system, the cultural biases in healthcare, we historically have not liked to discuss mental health and the stigmatization that comes along with that. Right. And so for that reason, I decided, according to, of course, directions from God, to apply for a chaplaincy at St. Elizabeth's Hospital as a mental health chaplain, to get training there and try to help make the difference. And DKWeb Ministries is actually an extension of WIN Ministries that I started in 1995. The acronym stood for Walking in Newness of Life. And so within that context is to help individuals to get to a holistic being, to help people heal spiritually, emotionally, physically even, because a lot of times with African Americans, we don't like to go to the doctor.
We don't take care of ourselves.
We don't take care of ourselves. And we must realize that mental health illness is just a sickness in the brain. It really is a sickness, and we need to, see the appropriate professionals in that light. So that helps me with DKWeb Ministries to extend that and extend the arm of the ministry to go out and help the community become more aware of the mental health illness and also the need, Pastor, to become more involved community-wide to help people understand that it's not shameful. You just need to go see your physician, just happens to be a psychiatrist. Right. Or a psychologist.
So if you have high blood pressure, you see a doctor.
Absolutely.
If you have a mental health illness or you have some symptoms of
Absolutely.
Mental health issues, then you go see a psychiatrist.
Absolutely.
And so we have a psychiatrist with us today. Yes. So Dr. Moloch, could you tell us a little bit about your background and explain what you believe to be the statistics that are emerging in the African American church and what you see as a pastor in an African American church or in a church.
Okay. First, I want to just make a little correction. I'm a psychologist. I'm not a psychiatrist.
Thank you.
And so I wear two hats. I'm a professor of psychology at George Washington University, and my research actually is suicide prevention in African American churches. So that's where my research base is. But we also train doctoral students, PhD students, to do mental health care and also research in the community. And part of what we are known for at George Washington is because we work in very diverse communities, and we work in low-income communities. So students who come to us actually want to get training in that area. Okay. I also am a co-pastor with my husband of Beloved Community Church in ICOD, Maryland. And so kind of what has emerged out of that for me is I've noticed maybe 20 years now that much of what Prophetess Webb said, that people in the Black church were wounded and hurt, but wouldn't get help for it. And so part of my emerging research interest came out of, well, when Black folks are hurt, who do they talk to? And finding that there's lots and lots of misunderstandings, and some of it's well-deserved because historically the mental health community has not always treated people of color in a way that's been kind and equitable. But the good news is that more and more people get training in that area. And so I was watching people kind of suffering silently in the pews, and just, it was breaking my heart because I thought, there is help available. I think particularly around the issue of depression, which is where my expertise really is. You watch people and sometimes people almost normalize that, like this is all that life has to offer. And I'm like, God intended us to live an abundant life and live it fully. And so that might mean taking a little pill, that might mean going to see someone for counseling. And so we need to really broaden how we understand God's healing. And and I also tell people, get people who are credentialed. Just as you would not have a plumber come into your home without knowing that person's licensed, a mental health professional needs to be licensed as well. And you have to do your homework, but there's lots and lots of treatment that's available for people who don't have to suffer.
Perfect, thank you. And Mr. Jones, tell us about preventive measures, because that's what you do. You're involved in identifying as well as treating, identifying issues, identifying professionals that can address issues for people. So could you tell us a little bit about your organization, and then how do you feel the church and the community has been handling mental health issues, and how do you think we should begin to address it?
Yes, thank you. So we at Preventive Measures, we serve the community, both children, adolescents, and families in the area of behavioral health services. We're a traditional outpatient mental health clinic, and also we provide some community-based services for all of our clients. So we hire professionals that have both psychiatrists, psychologists, licensed independent clinical social workers, as well as bachelor-level social workers to provide a number of services to our clients, ranging from individual therapy to family therapy to medication management and other clinical assessments and evaluations. I think the way the Black church has been managing this phenomena is really based on the pastors and the leaders. And it really starts with them from a point of education and educating, becoming educated about behavioral health services, as well as then educating the church and the members, and having them be more aware of what a mental health disorder looks like. Just like many of the other medical issues, the African American community has a disproportionate higher concern because we're not being educated. Therefore, as Prophetess Webb said, so we don't go to the doctor because we're not educated and we don't know what to look for, so we don't go to the doctor. So again, those clients don't come to the clinic. They won't get a clinical assessment because they don't know.
Right.
So I'm happy to say we've started to work with more churches and pastors who are more progressive in how they think about mental health. And that has now opened up our doors to some clients who may maybe would not have come out to get an assessment some time ago.
That's wonderful. I want to talk more about the stigma.
Yes.
Because that's what I see as a problem. I'm as you all know, an associate pastor at a church under Bishop Glenn A. Staples, who is a phenomenal bishop and pastor,
Yes.
and very progressive. I'm also the general counsel. So for me, what we see a lot of times, and I've been in church for a number of years, when someone comes up and could be presenting with a mental health issue, if the church is not educated, then we take out our oil, we lay hands on the person, and we expect that they're delivered, and then they go back out and they're still suffering, they're still dealing with the same issues, they're still dealing with the same problems. And we use the word almost to cover it as a Band-Aid. But if they're suffering from a mental health illness, then they can't necessarily hear the word. They're not receiving the word.
That's right.
And so, Prophetess, tell me a little bit about the stigma and why you think the Black church is still confronted with that stigma. And then, Dr. Moloch, if you could tell us what are some of the symptoms that people should begin to look out for if they feel that they might be suffering and need to get some help. So let's talk about stigma.
Well, I sincerely believe, Pastor, that the stigma really stems, as Mr. Jones said, from the head. Me having pioneered a church, being a pastor myself, is that we don't really acknowledge that we're hurting ourselves. So in chaplaincy, there's this wonderful book by Nowen that the name of the book is The Wounded Healer. So we are looked to as the healers. But when I have an open wound that is gaping and I don't know how I'm going to get it fixed because everyone is coming to me to fix it, then I cannot let people see that I'm wounded. So it really starts at the head. And I think that kind of segues into why we're seeing this trend of pastors who are committing suicide because they're overworked, underpaid, stressed, and feel that they have to be that healer, that know-all, that cure-all. So I really believe that stigma begins in that the head doesn't want to acknowledge their own, their own feelings of, how can we say it, not even being incapacitated, but their own feelings of being not sufficient enough to handle this load. So I think with pastors, we have to realize that we also need help.
Right. And it's not a question of faith.
No.
See, that's what I
certainly
think
not a
people
question.
think, right?
Absolutely
that it's
not.
a question of faith. If you can't believe the
Absolutely.
problem away,
No.
then you don't have enough faith. But it's not a question of
Absolutely
faith.
not, because it's physiological.
Amen.
And as Dr. Moloch will speak to, I'm sure, when you're depressed, you start having some physiological problems. And so physiological problems are not always alleviated by just getting some oil. We need now some healthcare professionals to deal with the physiological problems. And so I would like, even from this show, for pastors that's listening, to understand that you are not weak. You're really more intelligent when you reach out and get the help that you need. That then you can help your parishioners.
Absolutely.
Then you can be a more holistic leader.
Absolutely. And some of the signs and symptoms?
Yeah, just to piggyback something else that Prophetess Webb said, one of the issues, that book actually, I used to teach at Howard University School of Divinity, so that book was required. Yes. And I think what we have to realize as leaders also is that when you minister out of a wounded space, that's the space you minister out of. If you don't get that part healed or at least addressed, then you're going to probably, without meaning to, you inadvertently hurt people.
Yes.
And so I think in terms of looking at the signs and the symptoms, I'm just going to pick depression because depression actually is fairly common. 1 in 5 people will have depression. So when you ask me for statistics, in my church what I tell people is count off by 5s. And every 5th person, that's probably the number of people in here who are experiencing depression. And so you're right, there are some physiological symptoms that you can have. Some people are very tired. People are either sleeping too much or they're sleeping too little. And some people we have called early morning awakening. So you fall asleep, wake up 2 or 3 o'clock in the morning and can't go back to sleep, which is a form of insomnia. Sometimes, believe it or not, your mind is kind of cluttered and you can't think as clearly as you used to. And so what happens is because when you're depressed, your whole brain functioning slows down. So simple decisions become really hard. And so things like, what coffee to wear, what coffee to drink this morning. You can look up and 30 minutes have gone by, you still haven't made that decision without realizing that your whole brain functioning has really slowed down. People can feel sad. Some people don't feel sad per se, but they feel really irritable. Particularly in younger people, you'll see the irritability and sometimes the anger that comes out of that. Easily frustrated, wanting to isolate yourself, feeling that no one really understands you or gets you. And part of it, why it's important for everyone else to understand the symptoms too, is I think one of the tricky things about depression is everybody feels depressed sometimes. So there's a depression that's a normal reaction to certain things, like you have a loss in your life, but then there's clinical depression. I think ironically, because we all feel depressed sometimes, we don't get clinical depression. So most of us want us to pray our way out of it, or snap out of it, or if your faith was strong enough, you would, and that's really cruel to tell someone that, because you don't realize how much they've been struggling. And when someone is under the throes of depression, something like getting up out of bed and getting your clothes on can be really, really hard. And so you have to have a lot of patience and also a lot of compassion.
Yes.
And I think the other piece I like to tell people is that it's such a myth to think that being quote unquote strong is not experiencing them. The strength comes in recognizing you have a problem and getting some help about it.
Absolutely.
Absolutely.
Absolutely. And Mr. Jones, we talked about, I think Prophet has talked about pastors and leaders, and then Dr. Moloch, you picked up on it, but you deal with the family.
Yes.
So can you talk a little bit about the family dynamic? What happens when the head of the household is suffering, and how that translates into how the children are affected?
Sure. One of the things I always say, even with our relationships with pastors and churches, is one of the things we have in common is people. So we're helping people. And as it relates to the family, anytime one of the family members is diagnosed with a mental health disorder, then everyone is impacted. So we always encourage family sessions for anyone who has been diagnosed within that family structure.
Great, and we're going to put a pin in that because we are out of time. We're going to take a break. Please don't touch your dial, because we have a lot more to talk about in this exciting segment from Behind the Podium, conversations about law and faith.
Hello, I'm Lorette Farris. I'm here to introduce you to iBoss.com Inc., your back office systems and services for capital formation strategy specialists. iBoss leverages industry experience and resources to help clients reach the investment community through channels that include social media, direct mail, email, press release marketing, and other target market means. iBoss will manage the process from concept to execution as we help you compliantly develop investor-friendly presentations and processes to attract qualified investors. We are ready to be of service to you. So pick up the phone and give me a call or email me today at 240-645-0993 or lfarris@iBossInc.com. Also, don't forget to watch my 3 favorite cable shows, Skills to Pay the Bills, Rock Your Block, and The Cool of the Day on Fairfax Public Access. Check the dates and airing schedules at www.fcac.org. Thank you.
Welcome back to In the Cool of the Day and our segment from Behind the Podium, Conversations of Law and Faith. Before we broke, we were speaking with Mr. Jones about the family dynamic and mental health with the family, and how if the leader or the head of the household is affected, how the family is affected. So you were talking a little bit about how it sort of translates down from the head, whether it's a mother or father, and then to the children. Can you expand on that a little bit more?
Sure. As I said, anytime anyone has a mental health disorder in the family, the entire family is impacted. Certainly, if the head of household is impacted, the influence can be greater. But equally as important, if the youngest of the family gets impacted, gets diagnosed, then the family can also be greatly impacted. Therefore, we always suggest family therapy along with individual therapy whenever someone is diagnosed with a mental health disorder.
And is that challenging? I mean, have you found it challenging when, let's say, a child is diagnosed to engage the parents, and likewise when a parent is diagnosed to then get them to understand that the whole family has to be engaged? Is that challenging?
It is challenging. What we find most of the time is when a child is getting diagnosed, that's because there was a parent paying attention. Mm-hmm. Therefore, that family therapy is more likely to happen. But the contrast is when an adult gets diagnosed, we find that it's less likely that they're going to want their family involved in the family therapy, because unfortunately they sometimes want to isolate themselves and kind of get better and not tell the family, although the family is being impacted. So those are the two differences.
Right. And certainly, Dr. Moloch, I'm sure you see the same thing.
All
Engaging
the time,
the family
yeah.
is difficult. What's been your
I
experience?
think I teach a class in abnormal psychology, so I have young adults in there. And one of the things I share with them is that I want you to imagine that you have a child and trying to talk parents into hospitalizing that child, which is always very difficult. Because I think the thing that we forget sometimes is extremely stressful, as Mr. Jones says, for the entire family. Also, your child has periods where they're functioning okay, and we tend to start living for the honeymoon of that. So it's like, this week Johnny had a good week at school, so now you think, now he's on the road to recovery. And all of us have sort of ups and downs in our lives, but the difference is when you have a mental illness, the longer that you go without treatment, the more downs you have. So it's extremely stressful for the family. I think as Mr. Jones said, with the head of the household, and this is not unique to Black folks, so we keep secrets a lot. So it's amazing to me really how resilient people really are, because sometimes by the time people come to see us professionally, they are really not functioning well. And so one of the reasons we want people to have warning signs is to say, you know what, let's catch this really early so that you don't have to spiral all the way down. The parents I've said, let's make it a goal that your child doesn't have to go in the hospital this year, which means you have to be educated about the warning signs so we don't get into a crisis. Let's catch this and nip this in the bud before the crisis comes.
Yes.
And then Prophetess Webb, you see patients, people, saints in crisis.
Yes.
You're working as a chaplain in a mental health hospital. And so by that time, as Dr. Moloch just articulated, they have to be hospitalized. So what type of dynamics do you see with respect to family? And then what role does the chaplain play in a mental health hospital?
Well, certainly, as Mr. Jones has forestated, it certainly impacts the families. As a chaplain in a mental health facility, we find that a lot of the individuals in care are there because of even co-occurring disorders. And that's why recently we changed to the Department of Behavioral Health, because a lot of those behaviors, and one statistic with homelessness, 45% of African Americans in Washington, D.C. are homeless. So you find that a lot of times they end up in St. Elizabeth's once they've gone to a local hospital, and the healthcare professionals try to stabilize them mentally, and they still aren't stable, and then they have to come there. Well, a lot of times those individuals in care has loving families, have wonderful families, many families who are in ministry, but now their hands are tied. God, what do we do?
Yes.
And so I really applaud those families for then recognizing that this problem is beyond you.
Yes.
So get the professional help that you need. And so there in St. Elizabeth's, of course, we know and we realize that I would like to say we're going to become one of the premier mental institutions, because we do deal with the holistic man.
It's exciting to hear that they're opening up the doors of the hospital to the community.
Yes.
Again, erasing that stigma.
Yes.
Not only in the community, but again, I hear that you're doing some outreach at churches as well.
Absolutely, absolutely. Through a new entity that is a vision that the Lord gave me, Diadems, and that's what we're trying to do in order to dispel those emotional and mental stigmas. And go around to the churches and do some workshops and try to, just to get them to understand that, or increase their awareness that your congregation needs to have workshops and hear from professionals such as these on the panel and yourself that it's okay to be ill mentally, because we do have a lot of resources to help you. It's not behind the dark curtain that you have to stay, that you can come out and go to a mental health professional just like you go for hypertension, diabetes, those things that really impact the African American community. And so we're excited about that new endeavor, Diadems, going and doing those workshops.
Great. And Dr. Moloch, you go into the church as well.
I've been doing this 20 years. I was thinking about this the other day, a long time. Started off doing mostly, ironically, I was running women's groups, and I noticed that a lot of the women there were either depressed and had histories of child sexual abuse. And so I remember I would go into churches and they would say, well, we can talk a little bit about the depression, but not the sexual abuse. And I was like saying that I might as well not open my mouth, because about 1/3 to 1/2 of the women had had some kind of sexual trauma in childhood. And so even if I didn't want to have expertise in that, I had to develop the expertise in that. I think what's really powerful, though, is to see, you're absolutely right, both of you, that when the pastors give people permission to go and get help, and it's as simple as just saying a few things from the pulpit, you know, instead of saying, my thing that really irritates me is when people say, you don't need no psychiatrist, you got Dr. Jesus. And so Jesus called himself a counselor, and the way that's spelled in the Bible is not a counselor like an attorney, but it's counselor like a healer. And so if Jesus could call himself the counselor, then why would we prohibit other people from doing that? So that's a powerful, powerful tool. Just giving people words of encouragement from the pulpit and saying it's okay will really free people up a lot to go and get the help that they need. And
that's exactly why we're here, and that's exactly why this segment, the launching segment of From Behind the Podium, is focusing on mental health. Pastors, leaders, parishioners, deacons, deaconesses, we encourage you, open up your pulpit, begin to discuss the issue about mental health in the church, and you will find that there are people that are crying out for help. Certainly, we're not saying don't pray. Certainly, we do believe in healing. Jesus is a healer. He is a way maker. He can heal your body. He can turn it around. But hope needs help. And we pray that this segment from Behind the Podium has helped you to understand the issue of mental health illness in the church. What's exciting is that there are solutions, and there will be a part 2. And we ask that as you're watching in the cool of the day, you stay tuned and look for the segment From Behind the Podium, because this great guest, the great guest that we have today, will return and we'll start talking about solutions. Thank you.